or you can take the show with you wherever you go by downloading the CBC Listen app.
Well, today we are joined again by microbiologist Dr. Joseph Blondeau at an interesting time. Regardless of your feeling on the rallies and protests, it's fair to say that they have grabbed the attention of Canada. Although the basis of the protests is COVID-19, for many it's been a distraction from news on the illness. I think it's fair to say that people haven't been watching the numbers as closely or reading as much about updates on it. Well, now's your chance to find out just what's going on in the world of COVID-19. Joining us now, Dr. Joseph Blondeau, head of microbiology at the Royal University Hospital in Saskatoon, and he also teaches about infectious disease at the University of Saskatchewan. One thing to remember here, Dr. Blondeau is not part of policy decisions made by government, so if you have a question, do give us a call right now. It's 1-800-716-2221. You could email bluesky@cbc.ca or tweet us at blueskycbc. Now, we're also live streaming today's program on the CBC Saskatchewan and Saskatoon Facebook pages, so you can ask your question in the comments section there, and we'll get to them as quickly as we can. And just a heads up, our Olympic updates begin today. So that's going to happen between 12:25 and 12:30 every day until the end of next week. So get your calls in now for Dr. Blondeau so you don't miss out. And again, we're very grateful Dr. Blondeau is spending the noon hour with us again today. Good afternoon, Dr. Blondeau.
Oh, hey, Garth. How you doing?
I'm well. Thanks again for your time today.
Oh, it's my pleasure. Thank you for asking me to come back on.
So we've already had some questions sent in to us, and many have to do with comments that the Premier made last week on COVID-19. And before we get to that, it's been a while since we chatted. So what's going on with COVID right now? How is the virus behaving? What are you seeing?
Well, Garth, there's, as we've learned out throughout the course of this pandemic, every day brings something new. And, there was a really fantastic editorial published in the journal Lancet just at the end of last week or about a week and a half ago. And for those not familiar with the Lancet, Lancet is probably either the top one or two journals in the world. And this was an editorial commenting on whether or not, the end of the pandemic was in sight. And the author, Dr. Murray out of Seattle, Washington, had sort of said that he felt that the end was near, but that COVID would actually stay with us even when the pandemic is sort of officially over. And within that editorial, he was citing a number of pieces of data that were really intriguing. And a couple of those would suggest that prior to the Omicron variant, the level of asymptomatic infections with some of the earlier variants of the virus may be in that range of about 40%. What's intriguing is that with Omicron, modeling data would suggest that the level of asymptomatic infections could be as high as 80 to 90%, meaning that there are many of us in this province, in this country, who might have been infected with this virus without ever knowing it. And obviously, if we're immunized, and we know immunization protects you from more severe disease. But another intriguing fact was that the data would seem to suggest that as of January the 17th, so just 2 weeks ago, 2.5 weeks ago, about 125 million people a day were being infected with Omicron based on the modeling data that was available. So, over a course of 10 days, if that number was right, it would mean that 1 billion people would have been infected with the virus. So it suggests to us that this virus is very deeply entrenched within our society, both in Saskatchewan and Canada and North America and the rest of the world, and that the vast majority of people, unless you are being tested, may not even realize that you may have contracted it. So this is leading to a lot of speculation that perhaps there is an end in sight to this pandemic, but we need to be careful because just because the pandemic might someday officially be over, it doesn't necessarily mean the virus is going to be gone. And then we'll still have to figure out how we're going to deal with a virus that has now become an endemic part of our lives and what that might mean, not only for us in the general population, but some of our vulnerable individuals within society, be those the elderly, those with underlying medical conditions, etc. So there's been a lot of interesting stuff over the last 2 to 3 weeks. And one of the things that I wanted to comment on, data released in Saskatchewan suggests that the number of hospitalizations have gone down since last week. So I think we have to look at these as very, very positive trends. And in the absence of a new variant of concern, I think things are looking up.
All right. I want to talk a little bit about the Omicron Sub-Variant. We heard a little bit about it, and then it seems to have dropped off the headlines. What do we know about the sub-variant that's circulating?
So that was dubbed the stealth variant, or the B2. And there isn't as much information, obviously, as there is about the original, the B1 lineage of Omicron, except to say that it was called stealth because there was some concern that it could be missed by some testing that was out there. But it doesn't appear to be any worse than Omicron. So in other words, it doesn't appear to have any characteristics which would be a concern over and above what we're currently experiencing with Omicron. It doesn't seem to have taken the same foothold in North America as the original Omicron strain has. And whether or not there's going to be anything more to this particular sublineage or not, I think remains to be seen. But at this point in time, it's recognized, it's out there, and what its true impact is going to be is not yet defined.
Okay, we're going to go to the phone lines. Jan is standing by in Regina. Hi, Jan.
Yes, hello. Good afternoon. Thank you for taking my call. I wanted to ask if there is any way to test oneself how much antibodies I would have after two vaccinations. And I tell you why. Just before Christmas, I went to get the booster shot, which was about 6 months after my second vaccination. And 24 hours after that, I got incredible, uncontrollable shakes to my body, hands, legs, head, all the other appendages, and very rapidly rising fever. I was trying to bring it down with Tylenol and ibuprofen, and eventually the fever reached 39.8. After 3 days of that, the whole thing broke. But I spoke to some of my friends in Europe about this kind of a strong reaction, and they said they can get a test of how much already antibodies people have in their system. Probably if I'd done that, I shouldn't even taken the booster shot. Hello?
Yeah.
Okay.
So the question you ask is do we have a test readily available that would give you some indication of how much antibody you have on board? There are serology tests that are available. We don't have any available in Saskatchewan, but you can get a test done through some private enterprises. But the reality remains the same, and that is that we don't have a threshold value from these tests to tell you whether or not the level of antibody that you have would be better than the level of antibody that I have in terms of protecting me. Most antibody tests will tell you whether you're immune or non-immune, but don't necessarily tell you if you're at a particular level, that means that you have better protection than not. And with COVID-19, one of the reasons why we don't offer a serology test is because I don't think that any of them have really shown themselves to be good enough to provide the answer to the question that you're actually asking. Will they show that you have antibody or not? Yes. And then the other point is that it's very difficult, if not impossible, to differentiate between those people who are naturally infected versus those who were immunized and what that difference might be. So the answer to your question is there are tests available, but will they give you the answer that you're looking for? Based on my knowledge in this area, I don't think so.
Okay, well, thank you very much. At least I know that I won't take the fourth booster shot if it comes on board. Thank you very much.
Okay, thanks
You're
for the call.
welcome.
I got an email from Jane. Jane writes, hello and thanks for your continued coverage of the pandemic and its complications. I just returned from Mexico and was required to do a COVID test at the airport. I'd been required to get a PCR test 72 hours prior to returning to Canada. Any idea what the percentage of people returning to Canada who test positive upon their return is? Is the cost warranted? And you might not have particulars. Maybe you could speak to how much of a risk international travel is at this point.
Yeah, I do not have those numbers. I've never seen those numbers, Garth, to know what that percentage is. So I just simply cannot answer that question. But obviously the risk is that somebody who's returning to Canada, gets identified as being positive and then has to go into mandatory quarantine. I don't have. I don't have a solution to this particular question, but I suspect that we might be getting to a point, and again, this is just complete conjecture on my point, where the need for this type of testing may have to be reviewed in light of the fact that Omicron is everywhere, and probably a lot of us were infected even if we were immunized and didn't realize it. Whether or not there'll be continued need for this type of screening for arrival into Canada, I think remains to be seen. That's the federal government's decision, obviously, to make. But I do think in light of what's going on, this is probably something that needs to be relooked at. That's the best I can do, Garth, because I don't have any data.
Fair enough. And we got this email from Robert who writes, I have a couple of questions. Given Scott Moe's announcement, he'll be ending existing COVID restrictions soon. What's the viral load and transmissibility rate of a vaccinated person compared to those not vaccinated?
So the viral loads in vaccinated individuals is lower, tends to be higher in unvaccinated individuals. Transmissibility with Omicron is different than what we've seen with previous variants. It's much higher. The virus seems to behave more like a respiratory, like an aerosolized type of virus as opposed to a droplet virus with Omicron. And whether that relates to small droplets or not, I think is anybody's guess. But in general, if you're vaccinated, your viral loads are lower. I don't have an absolute value than if you're unvaccinated. And transmissibility is the same. Symptomatic people are more likely to transmit than asymptomatic individuals. And, obviously close contact continues to be a risk factor when you're with people who you're unsure of whether they're infected or not, or their vaccine status. Can't give more specifics than that because there's no number associated with that. Mm-hmm. But we do know with Omicron that that incubation period is shorter. It tends to be 1 to 2 days versus, say, 3 to 4 days that we saw with some of the previous variants. And then viral load also declines quicker after the peak. Some people can remain test positive for several days after their initial positive result. So we do know something is being picked up, but how much that contributes to transmissibility is unknown.
And Robert also wants to know, as someone in their early 60s, immunocompromised, how concerned should I be with the announcement, and what precautions should I keep taking after public health restrictions are lifted?
Yeah, so I would tell Robert the same thing I've told everybody that's asked me this question, that if there's a decision taken that some of the current restrictions that are in place are going to be lifted, then each individual still has a responsibility to themselves and their families to decide whether or not there's still a level of protection that they require. So if I was an individual who, although 60 is not old, but if I was an individual that had advanced age and I had some underlying medical condition, then I would continue to make sure that my vaccine status remains up to date, and I would continue to practice some of these things that we have repeatedly said throughout the pandemic that are important, distancing and masking, etc. I still think there's a role for those to play with individuals that are in situations where their risks are elevated, say, over the general population.
All right. Okay, folks, if you're just joining us either on the radio or on our Saskatchewan and Saskatoon Facebook pages, our guest today, as he has been throughout the pandemic, is microbiologist Dr. Joseph Blondeau, and he's ready and willing to answer any questions you have about vaccinations, the virus, the Omicron variant, the spread of Omicron, the effect of vaccination, any questions you have about the nuts and bolts of COVID, now's your chance to get a good science-based answer. Our telephone number, as ever, is 1-800-716-2221. You can email bluesky@cbc.ca or reach us on Twitter @blueskycbc. If you're following along on Facebook, just put your questions in the comment section. And now, in just a moment here, we're going to take a 5-minute Olympic update on the program. These updates will air this week and next week. But if you have questions for Dr. Blondeau, do go ahead and call or send us an email, and that Olympic update is coming up in just a few moments. You're listening to the Blue Sky on CBC Radio 1 in Saskatchewan. Our Olympic update is next. And you're listening to Blue Sky on CBC Radio 1 in Saskatchewan. It's 12:30. Tori Gillis has a news update for us. Hi, Tori.
Hey there, Garth. Well, a protest that spent the weekend parked on a northbound lane of Albert Street came to an end Sunday evening. That group was protesting vaccine mandates. Police moved in on Sunday, and we're just learning more details about exactly what happened from the police perspective. They said they issued 30 parking tickets and 2 traffic safety tickets over the weekend, and 1 vehicle was towed away. We'll have the very latest on that coming up in your news. Also, we're heading to Saskatoon in the news, where the impending closure of Extra Foods on Broadway Avenue means another neighborhood won't have a full-service grocery store. We've checked in with former city planner Alan Wallace, who says the closure is part of a worrying long-term trend. We'll hear more from him and more stories coming up for you.
Right, thanks very much.
Thanks, Garth.
Tori's back at 1 o'clock with details on those and other stories. Okay, back to today's conversation. Our guest today is microbiologist Dr. Joseph Blondeau. He is head of microbiology for the Royal University Hospital here in Saskatoon. He also teaches about infectious disease at the University of Saskatchewan, and he has graciously been with us, every other week now since the beginning of the pandemic to answer your questions about the virus and transmissibility and vaccines. Good science-based answers to those questions. But I just want to remind you again that Dr. Blondeau has no role in setting public health policy. He's not a politician. So let's keep the questions. Let's keep the questions on track. Let's go to the phone lines. John in Regina has been waiting patiently. Hi, John.
Oh, hi. This is for Dr. Blondeau. I'm just wondering, you were talking about viral loads in the unvaccinated and vaccinated people. There was a question about that. I was wondering, I was under the impression, leafing through a few studies in the past, at least for when the Delta was dominant, that the viral loads were similar among vaccinated and unvaccinated. You were suggesting they're higher in the unvaccinated. Can you tell me the study you're referring to me? Because I'd love to check it out.
What I'll have to do is get that information to you. But yes, I can. I did, over the break there, I did pull up just to see if I could find remind myself of the source of that. And there was one study which actually looked at viral load data with Delta and also a little bit of work with Omicron as well, and said that vaccinated individuals will have lower viral loads and less likely to transmit so vaccinated individuals, lower viral loads and less likely to transmit than unvaccinated individuals. So yeah, I will dig that study up for you and I will get it to you.
This is for the Omicron, or is this for the Delta?
Well, it's with both. It started with Delta, and then, of course, some of that data was continued with Omicron.
Tell you what, John. John, share your email with Amanda. Just stay on the line for a moment. Share your email with Amanda. Dr. Blondeau will email the information to us, and we'll forward it on to you, okay?
Yep. Happy to look it up for you and send it to you.
Okay. Thanks, John. We got a question from Judy on Facebook. She wants to know, can you get the virus more than once?
Yes.
Okay.
Yep.
I want to share these emails. We'll get back to the phone lines right away. We got this email from Anne, and she's got a couple of questions for you. Anne has been diagnosed with COPD. Her illness is well controlled with the help of medication. The question is, should I proceed with mask mandates and vaccine passport requirements are lifted, or how should I proceed after mask mandate and vaccine passport requirements are lifted? How safe will it be to be among people who are unvaccinated, people who might be carrying the COVID Omicron virus, that is, vaccinated or not, while not wearing masks, not adhering to social distancing guidelines? So, in her case, COPD, what should she do once restrictions are lifted?
Yeah, so she's an individual that has chronic lung disease, and by definition is potentially at elevated risk for, more severe infection with COVID. So in her particular instance, again, my first line is going to be, you really need to consult with your primary health care provider in order to get some, patient-specific advice from your doc. But you're an individual because you're potentially at an elevated risk that vaccination is going to continue to be important. And at least as we transition out of restrictions, should that occur, and until we continue to gather data about how widespread the virus might be, then somebody like yourself may need to continue to exercise some of these extra safety measures, like maintaining distance from others, particularly individuals who you don't know, people outside of your social bubble, and continue to wearing a mask for the foreseeable future in order to keep yourself safe. I mean, that is the only thing at this point in time that I can advise. The other thing, too, though, is that, we do have the drug Paxlovid that has been approved for individuals who could be at elevated risk and who could contract the virus. That is something that could be explored in the event that you happen to become infected and become a person where there's a concern about infection being more than mild. But I would think in the short term, certainly masks will still be an important part of your life.
Okay. And her second question is, who or what helps the virus mutate and evolve into new strains? Is it individuals who are unvaccinated, vaccinated, animals, some combination of those? And connected to mutations, how might it all end?
It could be any and all. So a mutation is just an error in replication, or it could be the acquisition of new nucleic acid. That can occur if an individual is simultaneously infected with two viruses, for example, could pick up a little piece of nucleic acid from the other virus. Or we know, Garth, from bacteria, and we know from some of the work that I've been doing for years on antibiotic-resistant organisms, that a mutation can occur in bacteria just through normal replication processes, about 1 out of every 10 million copies of the organism. Once you get up to 100 million or a billion, which sound like a lot, but are really not when you think of microorganisms and an infection, then mutations can occur spontaneously as well. It's just a natural part of that density of either viral or bacterial replication. So that they occur naturally. They could occur in vaccinated, unvaccinated. Probably, I don't have data to substantiate this, but perhaps the longer a virus persists in an individual or a population, the greater the risk that a mutation can occur.
I got an email from Tim who writes, why do some vaccines give us lifelong protection against disease while others, like the COVID vaccines, don't?
Because if you look at things like measles virus and mumps, where for all intents and purposes we have lifelong protection, it's only because there's only one strain of those. There's no variants, and as a consequence, once immunized, even if your antibody levels are very, very low, it's believed that should you be exposed to this virus again, you would have protection. The other thing is, of course, is that when you think about measles and mumps, we don't have a lot of that left in the world.
Okay, let's go back to the phone lines. Martin is in Regina. Hi, Martin.
Hello. My question is, what do we know about the hospitalization numbers in adults with 3 doses and children with 2 doses?
Yeah, you know what? What a great question. I cannot answer that because at least I don't have that data. But what I can tell you is this. I pulled up the latest data in regards to the Government of Canada website, and that data is summarized up until January the 15th. It's not been updated since then. So if you look at the number of cases of COVID, about 53% are occurring in unvaccinated, and as high as 40% are occurring in vaccinated individuals. The remainder occur in people that are either partially vaccinated or not fully immune. But where the separation comes is in individuals that are hospitalized or in individuals that die. So what that data showed up to January the 15th was that hospitalizations, 71% of those occurred in individuals that were unvaccinated, and only 17% in individuals that were fully vaccinated. And here's where your question comes in, because we really want to have a breakdown of what was the age or underlying medical condition of those fully vaccinated individuals that were hospitalized. And then the last part of that equation is, of those who had died, 70% occurred in unvaccinated individuals, about 13% in individuals that were not fully vaccinated or were not yet at full immunity, and about 17% occurred in those that were fully vaccinated. And once again, your question is absolutely relevant. We don't have a breakdown of what was the age of these individuals or what were their underlying medical conditions. And that's from the Canadian data. But if we look at data released by the CDC out of Atlanta on American data, those individuals in the U.S. tended to be older and tended to have underlying medical conditions. So that's the best I can do to try and answer that question, because I don't have the demographic specific information on the hospitalizations and deaths by age or underlying medical condition in Canada.
Okay, Martin, thanks for the call. We're going to move on now to Valerie at Little Pine. Hi, Valerie.
Yes, my question is with regard to mutations and the fact whether it's COVID or the more recent one that's not so bad. Given that we have third world countries, whether it's Africa or whatever, and I don't mean it in a facetious way or a bad way, but anyway, that don't have access to the same vaccinations that we do, that are available in the world for various reasons. And I don't know whether the pharmaceuticals have allowed other companies to produce their products or not yet. That seems to be a big issue. And then just getting them to the grassroots people everywhere. But given there's millions of people around the world that don't have access to vaccines, I'm assuming that there's more possibility for mutations. It's not my assumption. I think it's a scientific assumption. But has there been any monitoring of that? And do we know any more about that? I haven't heard about it lately.
Yep. So I can actually tackle that question. Your point is absolutely right. That is exactly where the concern is. Concern is not from sort of Canada, United States, Western Europe, although a new variant can arise anywhere. The concern is, of course, in underrepresented parts of the world where the vaccination rates are lower than they are, say, in Western Europe or North America. That the virus will persist longer, and then the likelihood for a variant arising could increase. And there's a lot of political pressure to try and get more vaccine to some of these underprivileged countries in order to get their vaccination rates up. But there are two problems. One is that getting the vaccine to some of these countries is one issue. Having the infrastructure to administer it is another. So if, let's just say, for argument's sake, you take a country like Canada, and Canada says, I'm committing X number of millions of doses to another country, and those doses get there, but they sit there because there's no infrastructure to get them in the arms of individuals, then that is not a problem for Canada in the first instance. It's a problem for the receiving country to say, how are we going to get these vaccines into these arms of these individuals? What's going to be the movement in our infrastructure in order to do that? So it's not as easy as it sounds, but at the same time, I fully agree with you that this is something that needs to be done. The second part of that is that if you look at the more recent modeling data, because of the rapid spread of Omicron, the predictions are that somewhere between 50 to 60% of the global population will have been exposed to Omicron by March. So even in the absence of vaccination, a lot of people are going to be naturally infected with the Omicron COVID-19 variant, and that's probably going to occur regardless of whether or not vaccine rates increase in some of these countries or not. So I think it's a combination of all of these things that you bring up. And I think it's a really important argument and discussion for going forward about how do we continue to serve some of the underprivileged parts of the world.
Okay, Valerie, thanks very much. Thanks, Valerie. Let's hear from Rob in Saskatoon. Hi, Rob.
Hi, Garth. Hi, Dr. Blondeau. So I'm a 68-year-old individual. I've been triple vaccinated. I'm also one of the at-risk or heightened risk individuals. I've been triple vaccinated. And nevertheless, I managed to catch a sore throat January 20th, to be exact. And the next day tested positive with a rapid test. So I had a kind of a cold for about a week that I tested positive. Now I'm over it, although there's a little bit of a raspy throat that's been hanging on a little bit yet. So we're going to a big ski race out at Edmonton this weekend, February 12th. And I'm wondering at this point, if there is a risk still of me spreading it to my fellow skiers or of catching it again. What's the risk of me to others or others to me?
So, how many days since you were tested positive?
I first tested positive on the first test that we took the 21st. I may have been positive on the 20th. I don't know.
Yeah, so you're 2 weeks out from when you first tested positive, and so that
I've been testing negative for over a week now.
Yeah, so that the likelihood that you'll transmit to others, that would be infinitesimally small. There is now some data suggesting that if you've been naturally infected, you have somewhere around 3 months for sure, where the likelihood for waning immunity would be problematic. So I think NACI, the National Committee on Immunization in Canada, had sort of said that if you're naturally infected, you can wait up to 3 months after that natural infection before you consider a booster. I think in Saskatchewan, what we have said is that if you were naturally infected and you're past your symptomatic period, then you can actually go for your booster at that point in time. I don't think there's a right or a wrong there, but given that you're within that 3 months, you would have some level of protection.
Okay, there's no fourth booster at this stage, is there?
No, but because you were naturally infected, you in fact didn't have some type of a booster just through natural infection.
Right. Okay, but I shouldn't be looking for a fourth booster, in 3 months unless I hear something in the news, right?
That's right. And if an eligibility comes up, then I think that's at that point in time that you consider your eligibility and then going for it. So yeah.
Okay.
Garth, Can I sneak in a second question?
Yeah, go ahead.
Okay, so I've had 3 COVID shots. I've had 2 Shingrix shots. I've had my annual flu shot. The most I ever got of any of these things is a little bit of a sore arm for a day. So I've been told by some that don't believe in the vaccinations that it can change your DNA. It can. It's got graphene in it. It's very bad for you. All kinds of bad things have happened. What really, Dr. Blondeau, when we cut through all the misconceptions, what really is the risk of getting the vaccine?
So this is an RNA virus. It's not a DNA virus, and there's absolutely no evidence that it can do anything to your DNA. I can't see how that would ever be possible. And I think that for people who think that messenger RNA vaccines are a bad thing, keep in mind that your body produces messenger RNA every single day that you're alive. It is the process by which you make proteins. It is the message that carries the nucleic acid code by which it gets translated on ribosomes to give rise to the proteins that need to be built for your body to sustain life. So for those that say that this changes your DNA, there's no evidence for that. And I've had this question more times than I can remember, and I can't think of a reason why anybody would think that that's the case.
Okay, we're going to move on. Thanks very much for the call.
Thank you.
Robin on Facebook, it's a little hard to make out exactly what Robin's getting at here, but I think what Robin wants to know is if you have been infected with COVID, how long would you be protected? 4 months, 6 months, longer?
Yeah, so it probably has varied a bit, Garth, with the different variants that we have had. But currently, the thinking is that 3 months should be fine. In other words, you should have some level of protection for 3 months. It's probably longer. But given that Omicron has only been here since the end of November, early December, we probably don't know the full story about that because people will need to be tested longitudinally in order to see how long they remain protected. But right now, some of the conventional recommendations are saying at least 3 months.
Okay. Let's hear from Brad in Watrous. Hi, Brad.
Hi, how are you?
I'm well, Brad. Go ahead.
Good. Hey, so my daughter got tested positive for COVID approximately 4 weeks ago, had the symptoms, sore throat, runny nose, cough, all that kind of stuff. Was testing negative up until about the 6th day, and then she tested positive.
Yep.
Then the symptoms were starting to go away when she tested positive, and then because of school sport, about a week later, or 2 weeks later, I guess it would have been, she had to test before she played a sport and tested positive again. So then we waited for the 5 days, and we went and got an actual PCR, and it tested positive, of course. But none of us, there's 3 other people in my household, none of us got it. So I'm just wondering, I had recently had my booster, and my wife recently had her booster, and our youngest was just eligible to get her first and second shot. Would that be possibly the reason that none of us contracted it?
It could be. I mean, there's lots and lots of reports of individuals within same households where the virus has been detected in a family member who did not get positive. One individual who I go to the gym with, 3 out of 4 members of their family were positive, and the 4th member never was. A question for you, with the testing that was done on your daughter, was it all by home antigen, or did you have PCR tests in there as well?
The 2 of them were the rapid test, and then after the second positive, we got her tested with a PCR test. We booked an appointment and went and got it tested, and it came back positive as well.
Okay, so with PCR tests, it was known early in the pandemic that they can remain positive for a long period of time just because you might be picking up remnants of nucleic acid because the tests are so sensitive. With the rapid test, it is possible. We've heard cases of this where people are saying, well, I was negative one day, and then I tested myself a few days later and I was positive. And that's just because it really depends on how the specimen was collected, whether or not there's much antigen there to pick up. There are a number of reasons for that. And that's why, the recommendations are that you have to wait for X number of days after you test positive, because that is what's believed to be the time course for the body to clear the virus. There's been a lot of discussions about whether or not once you test positive, whether you should be retesting yourself later on, because it does provide some confusion for some folks. But I think if a person is beyond their 10 to 14 days, and I think you can, regardless of a PCR result, unless it was an extraordinary circumstance, that person would be safe at that point.
Right. And then, because we were in the house, we weren't trying to stay apart. Sitting right beside me on the couch with a runny nose and everything like that. And so, we obviously breathed in the germs and stuff that she was expelling. So would we, because we breathe it in, be safe to assume that we've kind of been in contact with it and we're all safe from it for a little bit, sort of thing?
It might be a safe assumption, and if the data that has been released suggests that a high percentage of the population could be asymptomatic, then it's quite possible that you were infected and you never knew it. There was one paper that was published that suggested that that depending on what the positivity rate was, we call them CT values or cycle times, what that was with PCR would determine whether or not you would pick up a positive by a rapid antigen test. So it means that if you're a hot positive, then you're likely to be positive by a rapid antigen test. But if by PCR you were a soft positive or a light positive, then that may not be picked up by a rapid antigen test. So it's theoretically possible in your family, you may have been exposed, but maybe you had a really low viral load. And maybe your immunization helped you deal with that quite expeditiously. And as a consequence, you never tested positive and you never had any symptoms, even though you were potentially exposed.
Right, yeah, because we had been testing when I went back to work at the beginning of the week, and my other daughter was at school, and nobody else tested positive other than the one that had it. So,
okay,
lots of families are reporting that. Yep.
Okay, I'm going to squeeze in another call here. Arlene is in Prince Albert. We're running out of time, Arlene, so go quickly.
All right, I will. I just have a question in regards to the booster shots. I had COVID before the vaccine came. And following that, my blood pressure dropped to 64/42. I was hospitalized and stabilized. Then I had 2 Pfizer shots with no reaction. My third booster shot, 24 hours later, my blood pressure dropped to 54/42. My question is, when I get to an opportunity to take the next booster shot, how concerned should I be regarding this blood pressure getting so out of control? It usually takes a little while to stabilize again after that.
Yeah, so you need to have that discussion with your primary health care provider, your doc, and take a recommendation from your physician on what your action should be, and he or she could consult with the folks on the vaccination teams to see whether or not there's a link between the vaccine and what you experience, and then whether or not it's safe for you to proceed with the next dose when that becomes available. It's not an easy yes or no answer. I think that's a very individual thing, and that needs to be discussed with your healthcare provider. So.
Okay, we're going to move on, Arlene. Thanks very much.
Okay, bye-bye.
Bye-bye. I want to deal with some, I'm going to call it chronic misinformation before you go. And that is this misinformation that's circulating out there. And this comes from Francis. Why hasn't the data on the number of people who have either died or been left with chronic debilitating health conditions as a result of post-vaccine injury been shared with Canadians?
That data is being compiled. I think that you can go to a number of different websites to look where that data is reported. There is a reporting system that is a legal requirement that if there has been an adverse drug event associated with a particular product, that has to be reported. The reality is that the number of severe reactions associated with these vaccines are very, very rare. That is the reality. And that has been the reality with all of the vaccines that were approved, both the Pfizer and the Moderna, the AstraZeneca and the J&J. Now, I will say, Garth, in some individuals that had some of these severe reactions, they were like some of the blood clots. Those are not severe reactions that we should minimize. Those were, in fact, very severe. However, they were rare. They still remain rare. And the risk of getting COVID and having complications, including long COVID, were thought to outweigh the risks of vaccination. And so if there is misinformation out there that there are more deaths associated with vaccination or more side effects that are being hidden, I don't believe that at all. I've not seen any indication of that whatsoever, and that is just misinformation.
Okay, and one more question. This is from Sandra on Facebook. My sister was told that after contracting COVID, she would test positive on any COVID test for up to 90 days. Is that so?
It's possible on a PCR test. You can test positive for a prolonged period of time, but you wouldn't expect the same thing with a rapid antigen test. No.
Okay, and one more. We got like 30 seconds. Do we have any more information on the lasting effect in children under 5 of COVID infection, especially Omicron?
I don't have any up-to-date data on that I can reliably comment on.
Okay, and that's about all the time we have because we're going to run out of time right away. Dr. Blondeau, as ever, thank you so much. You've been so generous with us over the course of it's been 2 years now, if you can believe that. So thanks very much again, and we'll talk again soon.
It's my pleasure. You take care and be safe.
Dr. Joseph Blondeau is head of microbiology at Saskatoon's Royal University Hospital and teaches about infectious disease at the University of Saskatchewan. Lots of emails left over, lots of calls. So we're going to have Dr. Blondeau on again, maybe a little quicker than we had originally planned to deal with some more of your questions. That's our time together for today. We're going to be back here tomorrow at noon. Hope you'll join us for your lunch hour tomorrow as well. Until then, folks, have a great afternoon.